for this opportunity to speak to you all about the November 6 elections and the future of our nation's health care. And the future of our nation's health care does absolutely depend on these elections. I want to talk to you about why these elections are so important for the future of health care in our nation. I hope to provide information about Medicare, Medicaid, and health reform, and the very different plans that the candidates and the two major parties have for these programs, and why it is so important that voters are informed on health care issues when they go to the ballots November 6th. Many of you probably already know that the future of these programs, along with Social Security and the retirement age, is up for grabs with these elections. But it's not just the presidential and congressional elections that are important. Elections for state legislators are important too, because health reform and Medicaid expansion depend upon action at the state level. Health reform is not just a national law and everything happens at the national level. It actually grants a tremendous amount of power and authority to the states, but the states have to enact the provisions of health reform to really bring it to life. So the state elections matter very much as well. I'm not going to get into a lot of policy details or statistics. If you want those, you can ask me questions afterwards, and perhaps I can answer them, and perhaps I can't, or I can go and look up the data for you. But I'm just going to try to give you the big picture on healthcare policy from a consumer perspective. As a nonprofit charitable 501c3 organization, Champaign County healthcare consumers cannot endorse candidates or tell you who to vote for, but we can carry out voter education activities so you have the information you need when you go to the polls. We can give you all the information that you need. You all are smart people. You will figure it out. If you care about Medicare and you like the way it is now, you can figure out where a candidate stands, and if you want to vote for that candidate. You can also look at the party, whatever party you're interested in, and see where they stand. And you can look at candidates' web pages and get information from them. First, a little bit of background on my perspective. As Mike said, I've been with healthcare consumers for over 15 years now, and during that time we have consistently advocated and fought for legislation that would expand access to quality, affordable health care for all, including single-payer legislation, and legislation that would regulate the health insurance industry. It's been desperately in need of regulation for a very long time. In all those years that we've been fighting for these changes, I have never seen an election more important to health care than this one. Even in 2008, when the possibility of some sort of health reform was on the table for sure, but in that election, the future of Medicare and Medicaid were not up for grabs the way that they are now. So this election is even more important to health care than the previous election. To many of us healthcare advocates, this election, in terms of the policies and programs that are at stake, is a no-brainer. And yet, people remain confused or totally lacking in the most basic knowledge about Medicare, Medicaid, and the health reform law, and what it already does and what it will do. But this confusion is not surprising when you consider the extent to which health care and a reasonable discussion of health care has been held hostage to politics. To understand this confusion, or to help remind people of it, just think back to the ridiculous, bombastic, and dishonest national dialogue about health reform that took place after the last elections. Remember the death panels? I mean, that was just ridiculous and a flat-out lie. Remember how those who were advocating against national health reform would talk out of both sides of their mouths, saying that President Obama was both trying to get government over-involved in health care, and yet they were advocating for him to get his hands off their Medicare. Remember that? You know, a bunch of us went to a town hall meeting for legislator, for Representative Tim Johnson, Congressman Tim Johnson, and there were people in the audience, this was out of town, and there were people in the audience who had signs that said both that they were opposed to socialized medicine and get your hands off my Medicare, or government, get your hands off my Medicare. And in some ways, this is a tribute to Medicare, that it works so well for people that people don't necessarily see it as a government program. But we do need to remember it's a government program, and it's one that works very well. Anyway, but at that time, you know, my dream of sort of having a national conversation about health care and health policy was coming true. You know, for the first time, we're really going to get to talk about this. But then when this stuff started happening and coming out, my dream sort of turned into a nightmare, you know, like one of those that you can't wake up out of. So anyway, health care shouldn't be held hostage to politics, and voters need real information, so I hope to provide you with some of that today. So first, let's start with an overview of the health reform law. The Patient Protection and Affordable Care Act, also known as the ACA, and I just refer to it as health reform, is the bill that was signed into law by President Obama in 2010. Presidential, congressional, and legislative candidates are running on platforms frequently pledging to uphold or to repeal health reform. If you care about Medicare and Medicaid, you need to also care about the health reform law, because many of the recent and upcoming improvements to Medicare and Medicaid are a result of the health reform law. They're intertwined. Before I talk about health reform, let's just get some things out of the way. Let me say that we all know that health reform is not perfect by any means. This isn't a partisan statement, but just remember that it started out as a Republican plan that was proposed as an alternative to the growing possibility that Medicare would be expanded to cover everyone. So as a result of political realities, health reform is an awkward hybrid of public and private insurance coverage that keeps in place what is working and builds around it to fill in the gaps. And it is a plan that no one would have designed if they were starting from scratch. We all can agree on that. Whether you're for single payer, whether you want to get rid of health reform and come up with something else, or whether you support health reform, nobody would have designed it this way from scratch. Let's also remember, though, that health care and the need to get it or buy it is not like any other good or service. No one asks for cancer or plans to get cancer. And consumers have no way of knowing or predicting what the cost of their health care will be. When you're sick and you need care, you need to be able to go and get that care. It is stressful and scary enough having a serious health problem without the additional stress and fears about